Jaundice is a medical condition characterized by the yellow discoloration of the skin, eyes, and mucous membranes caused by an elevated level of bilirubin in the blood. Bilirubin is a yellow pigment produced during the normal breakdown of red blood cells. Normally, the liver processes bilirubin and excretes it in bile. However, when the liver fails to metabolize or excrete bilirubin properly, or if too much bilirubin is produced, jaundice develops. It is not a disease itself but rather a sign of an underlying condition, particularly related to the liver, gallbladder, or pancreas. Causes of jaundice. There are multiple causes behind jaundice, broadly categorized into three types. Prehepatic jaundice, before the liver, occurs when there is excessive breakdown of red blood cells, producing more bilirubin than the liver can handle. Common causes: malaria, sickle cell anemia, thalassemia, or hemolytic anemia. Hepatic jaundice, within the liver, results from liver cell damage or dysfunction, reducing the liver's ability to process bilirubin. Causes include hepatitis, viral or alcoholic, cirrhosis, liver cancer, genetic liver disorders, or drug-induced liver injury. Post-hepatic jaundice, after the liver, caused by blockage in bile ducts that prevent bilirubin from being excreted. Common causes: gallstones, bile duct tumors, pancreatic cancer, or strictures. Symptoms of jaundice. The most noticeable sign is yellowing of the skin and eyes. However, jaundice can be accompanied by other symptoms depending on the underlying cause. Fatigue and weakness. Dark-colored urine. Pale or clay-colored stools. Itching, pruritus, due to bilirubin buildup in the skin. Abdominal pain or swelling. Fever and nausea, often in cases of infection like hepatitis. Loss of appetite and weight loss. Diagnosis of jaundice. Doctors usually begin with a physical examination, followed by investigations to determine the cause. Blood tests measure bilirubin levels and check liver function enzymes such as ALT, AST, ALP, and GGT. Complete blood count, CBC, helps identify anemia or infection. Imaging studies, ultrasound, CT scan, or MRI of the abdomen to detect blockages, tumors, or structural liver disease. Liver biopsy, performed if liver disease such as hepatitis or cirrhosis is suspected. Treatment of jaundice. Treatment depends on the underlying condition rather than jaundice itself. Management strategies include: prehepatic jaundice, treating the cause of excessive red blood cell breakdown, such as managing malaria or blood disorders. Hepatic jaundice. Antiviral medication for viral hepatitis. Abstinence from alcohol for alcoholic hepatitis or cirrhosis. Supportive therapies for liver disease and possible liver transplant in severe cases. Post-hepatic jaundice. Surgical removal of gallstones. Stenting or surgery for bile duct or pancreatic tumors. Endoscopic procedures to relieve bile duct obstruction. Supportive care may also include hydration, nutritional support, avoiding alcohol, and medications to relieve itching. Complications of jaundice. If untreated, jaundice can lead to serious complications depending on the cause. Chronic liver disease leading to cirrhosis and liver failure. Severe infections in cases of untreated hepatitis. Obstruction leading to secondary infections of the bile ducts, cholangitis. Malnutrition due to poor digestion and absorption of nutrients. Increased risk of liver cancer in chronic conditions. Prevention of jaundice. While not all causes are preventable, certain measures can reduce the risk. Vaccination against hepatitis A and B. Practicing safe hygiene and safe sex to prevent viral hepatitis transmission. Avoiding excessive alcohol consumption. Maintaining a healthy diet and regular exercise to protect liver health. Regular medical check-ups for people with liver disease or genetic predisposition. Safe blood transfusion practices and use of sterile needles to prevent infections. Jaundice in newborns. One special type of jaundice occurs in newborn babies. Many infants develop jaundice within the first week of life due to immature liver function. This is called physiological jaundice and usually resolves on its own. However, if bilirubin levels rise excessively, it can cause kernicterus, a serious brain condition. Treatment may include phototherapy, light therapy, or, in severe cases, exchange transfusion. Conclusion: jaundice is an important clinical sign that signals underlying problems in the liver, gallbladder, pancreas, or red blood cells. It should never be ignored, as early diagnosis and treatment of the root cause can prevent severe complications. With timely medical attention, lifestyle adjustments, and preventive care, most cases of jaundice can be effectively managed, protecting liver health and overall well-being.